unique initiatives seek to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair or have bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Soma Sarkar, is a well-known dermatologist, has been practicing medicine for over many years now. She's MBBS, MD in dermatology and cosmetology. She specializes in dermatology, cosmetology, and trichology. Dr. Sarkar has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Sarkar is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Sarkar, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you, Mona, and thank you for such a humble introduction. And yes, we look forward to solving all the queries our viewers have.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss about hair care in current scenario. So whenever we talk about hair care in current scenario, the most common problems which is faced by all of us, irrespective of gender or age, is the hair loss. So doctor, can you enlighten us today what's normal and when to be concerned for?
So Mona, hair loss is something when you can term it as hair loss when you see you are losing more than around 100 hair daily. I mean to say losing 50 to 100 hair daily is very normal. But if you start seeing more hair, specifically while you're sleeping, if your bed covers, if your pillow covers are with full of hair, or your clothes, you see a lot of hair on your clothes, that's the time which is in an alarming state. Or sometimes you can see that your parting is widening up and you can see some scanty patches on your scalp. Losing hair during your hair wash, brushing, these are very normal counterparts which we come across, and one should not fret looking at them. But yes, when these are growing more in numbers, that's the time it's a place where you need to see your doctor.
Okay, that's interesting, doctor. So, doctor, now that we know that when it is abnormal and lot of hair we see on our bed, pillow everywhere is abnormal. So, what are the causes? Like, why does it happen? What are the general causes of hair loss? Can you please enlighten?
So again, hair loss can be categorized into 3-4 patterns. So one is the normal general hair loss. We have something known as alopecia areata, male genetic androgenetic alopecia, and we have something known as telogen effluvium. Now, the factors based are, especially when you see a male pattern baldness, it's more to do with the genetic predisposing factor. But when it comes to telogen effluvium, it is mostly because of your nutritional deficiencies or a body has gone through some kind of shock or stress or any kind of viral infection or bacterial infections in the recent past or any surgeries in the recent past. Or sometimes it's also because of autoimmune disorders, but that's not very commonly seen. But yes, we do consider this as a part of our treatment. But more or less in our patients, what we see is the nutritional deficiency which we come across regularly. All our Indian patients are somehow deficient in their micronutrition value. They're not eating well, their lifestyles are not well, and most of them are considered because of the lifestyle issues here, which can be addressed very effectively with few simple changes in your eating habits and your lifestyle.
Okay, doctor, like you said, lifestyle is also important. So can you, with your profound experience today, we got a chance. So can you please little elaborate for us, can a person lifestyle play a role in hair loss?
So, you know what, when I start with personal lifestyle, it starts with simple routines of yours. Like, how are you combing your hair? Are you using a white tooth comb or you using very harsh brushes, soft bristles or not, or a hard bristles, and you're combing it in, very vigorously and you're damaging your hair. Second is while washing your hair, what kind of shampoos and conditioners also are you using? Are you using too much of harsh shampoos which are not free of sulfate and paraben free? These are things which you can, in your daily practice. Third is that how are you tying up your hair, or how are you keeping your hair while you're sleeping? Like we normally advise our patients to use a silk scarf or some kind of bandana, cotton bandana while you're sleeping to cover your hair so that you don't spoil your hair while you're sleeping. Or do not tie your hair too tightly. You use the females use this scrunchies which are too tight and you're putting it on a ponytail or tying buns and you're just opening up and you're breaking a lot of hair. Also, what are you putting in your mouth? As I said, when it comes to lifestyle, what are you having in your meals? Are you taking the important nutrition in your food? Are you sleeping well? Because sleeping well will also keep your cortisol levels in place. It will also help you to increase your melatonin secretion. So these are things which also have to be kept in mind. Is your water intake enough to hydrate your skin? Are your free oxygen radicals being washed away in your system? Are you exercising yourself? Because again, exercise will help you to maintain your circadian rhythm. It helps to maintain your hormones in place. Apart from that, as I keep saying, that simple practices like, are you coloring your hair too much? Are you blow drying it too much? Are you using too much of heat styling tools and not using creams or lotions which are heat protector? So these can also damage your hair. So everything requires a maintenance. Though we all are in a century where we all want to look good and you want to do things to your hair, but keeping in mind simultaneously there is a maintenance which is very, very important for you. Even if you do hair drying, even if you blow dry, color, straighten, cysteine, keratin, there are a hell lot of things. But end of the day, you have to take care of the crowning glory, as you say. We have to take care of the main. And with simple practices, it's going to be easy.
Yeah, so maintenance is very important, not like blindly doing every experiment on our hair. Okay, so doctor, now that we know that lifestyle is important and what is hair loss and what are the causes, so the another question which we common people actually don't know, like what are the treatment option, medical treatment option available for hair loss? Like, is there topical or surgical, non-surgical, or is there any oral also like we can take and we can manage our hair loss problem?
So first thing is that we have to identify the cause of your hair fall. What is the basic mechanism because of which it is having. Secondly, yes, we have different categories of treatment. So we do have medical treatment, we do have surgical treatment, and we do have palliative treatment as well. So when it comes to medical, it definitely involves certain times oral as well as topical simultaneously. As I keep saying that majority of the times in Indians, we see a lot of nutritional deficiencies. So oral at some point becomes necessary. Secondly, when it comes to androgenetic pattern, the male pattern or the androgenetic pattern of alopecia, you also require to use certain drugs which will take care of those hormones involved there or certain enzymes. So sometimes we have to go a little bit more and use our oral medications to treat this condition. Yes, topical applications simultaneously have to be there, which includes your solutions, your peptides, sometimes it's like enzymes, shampoos, and a conditioner. When it comes to surgical, yes, when we see that the patient is not responding very well, or the case is too severe or resistant, and the patient wants to have a hair on the head, then yes, surgical intervention is important and it also adds up to the confidence of the patient. Apart from that, there's something known as palliative care where you can do a lot of miscellaneous treatments. Like, for example, you can do growth factor injections, PRP injections, you can do LED lights, infrared lights. So these are something, derma rollers. But please ensure that these things are done with the doctor's office, not in the house. These are not recommended to be done in the house. So these are things which can help you to maintain the crowning glory after you've taken a treatment for a specific period of time. So there are various options available now and which you can opt for depending upon your condition and your presentation.
Okay, very interesting, doctor. Like, instead of taking it blindly, any treatment, we should first know our root cause of the problem with the help of the doctor, because we do tend to do many home remedies for when the hair loss starts.
Yes, a
Okay.
lot of DIYs.
So, so the root cause is important, and first we should visit our doctor. So, doctor, there is one word called nutraceuticals, which is getting a lot of focus nowadays. So, can you please enlighten us what is nutraceuticals and what role does it play in hair health?
So, what happens is with our food habits, okay, we overcook our food. We Indians have this habit of overcooking our food, and we are not very used to having a lot of nutritional value food. Like we don't, a lot of population doesn't involve salads in their food or fruits in their food. So, somehow I have seen most of our Indian patients are deficient of iron, vitamin D3, and B12 because we also have a very big group of specific group of being vegetarians and vegans. So we see these kind of deficiencies on a regular basis. So nutraceuticals is a component or is a place where your nutritional value is supplemented. What you do not get from the from your food in your daily sources, you can probably supplement it overall so that you can use the benefit and get the maximum benefit out of it. As I keep saying, like there are examples. If you see, you have biotin, you have vitamin B12 tablets, you have vitamin niacinamide, you have your D3 supplements, you have your omega-3 fatty acids. So these are a lot of nutraceuticals which helps you to supplement and also works as an adjuvant therapy with your regular therapies if required for the growth of the hair, for the maintenance and for the good buildup of your hair sheath and to make them strong and make them grow better. So these are, I would not say these are the first line therapies though, but yes, it is nowadays required looking at the lifestyles. Most of the people we see are deficient in lot of, as I keep saying, vitamin deficiencies. Sometimes it's being physiological, sometimes it's pathological. But in any case, you require to supplement your food and you need to have these nutritional values in place.
So, like doctor, you said that these are nutrition values and the stuff. So, there are so many things in the market. Like some of the herbal, and some are the plant extract, and some are the phytoconstituents. So, what do they? What do are they useful for managing alopecia or hair loss?
So, if in general, mota mota, agar mujhe pucho, so what I would like to tell you, Mona, that see, I know that the market is full of concoctions and cocktails of medicines, and sometimes it's very difficult to choose what should I have. But majorly, if you ask me, when you look at a hair supplement, you should look at that it should contain a good amount of biotin. It should contain a good amount of vitamin D3. It should have a source of vitamin B12, zinc, okay, and other if you see these are one kind of nutritional supplements, and there's other supplements which should simultaneously be there in these capsules are like a cysteine, a copper, a zinc, amino acids, because amino acids are again useful for treating the keratin of the hair. It is useful in making the keratin of the hair. So these are things which we have to keep including into our nutraceuticals. So the combination basically should have vitamin B12, D3, majorly iron deficiencies has to be managed. So more or less, this will take care of your hair.
So, doctor, even now, the plant extracts are also getting very common in between Instagram, Facebook. So, like these grape seeds and this omega fatty acid, do they promote hair growth?
See, as I say that yes, omega has been a favorite agent since a very long year. Okay, so omega-3, 6 and 9 is definitely good supplements. Grape seeds, yes, we see a lot of these new saw palmetto. These are new, molecules which are plant derived and it's very useful in our routine. But you have to also understand that these only will not benefit you. So you have to have a combination of things which are very essential and non-essential fatty acids. Obviously they all contribute to different different parts of your hair, if I have to keep it simple. But yes, the major ones which has to be always there, combining with them, this would help. Only a plant extract or only something as an omega-3 6 or only a grapefruit will not probably give you the desired results. You will have to combine it with it. So yes, there are place for it, but I keep going back to my basics and saying, Mona, that we have to first identify the cause. See which is the nutritional deficiency that the patient is going through majorly. Because once you get through a batteries of investigations and you can point out properly and scientifically, okay, this is something what my patient requires. And that's what I advise all my viewers, that please do not blindly follow anything. Just look at the, those bottles and the ingredients and pick up your products, but please speak to your respective dermatologist so that you get a fair idea that what exactly you need into your system. Because every patient is different, every hair loss reasons and causes are different.
Mhm. So instead of, following social media and popping anything, it's better we should visit to the
Yeah,
doctor,
yeah,
get
yeah,
a
yes.
personalized hair care maintenance program. So,
Yes.
doctor, just say you said diet is important, or हम जैसे common people को we actually don't know what are those micronutrients or macronutrients. So, can you please enlighten us today from this platform? Like, what is the role of micro and macronutrients in our hair health? What are they? Like, what is micronutrients, and
See, what I would specifically say, for example, the first thing is you have to understand what your hair is. Your head is made up of keratin, and which is a kind of proteins. Okay, so our food should contain protein. Now, as I keep saying, that we have categories of people who are vegetarians, who are non-vegetarians, and vegans. Okay, so first of all, we have to ensure that we have good source of protein in our diet. Now, for non-vegetarians, it's very easy because you normally get it through the eggs, you get it through the fish, you get it through the meat. But when it comes to vegetarians, the sources are limited. So again, you will have to depend upon, sometimes soya beans or sometimes paneer. But even then, you cannot suffice the protein intake. Okay, so the kind of volume we require. So again, protein is a kind of macronutrients which you require and which you can probably supplement yourself with protein powders or sometimes protein. You get those vegetable protein, plant proteins, which you can use it in your daily diet. Apart from that, as I keep saying, zinc is one of the important factors which is required for your hair growth. Iron deficiency. Iron is something which is again a macronutrient which is useful for your hair growth, which is very, very important. B12 and D3, these are few things which are commonly found everywhere that you have to have them in your supplements. So these are things which you can also include in your food, not only supplements, but you can improve your food, which are rich in these kind of vitamins, and you can supplement yourself. So all your green leafy vegetables, your fruits, your dry fruits, these are certain elements which you can easily incorporate in your day-to-day eating habits.
like. Okay, doctor, very interesting. So, doctor, earlier you said that instead of taking blindly, we should take our planned program medication. So, is there any guidelines or something, like, is it required to take this nutrients as per some like gender RD requirement, or is there any requirement or any guidelines for these dietary supplements?
See, there are definitely guidelines to this, there are papers to this, but if I have to generally put you up simple and for people out there, in what we see is that females have the most of the nutritional deficiency because we also have a regular menstrual cycle. So we lose a lot of blood. So females normally are deficient in your iron. Okay, so this is something what has to be taken care of. Second category, as I keep saying, that the vegetarians and the vegans, because their dairy products and the meat involvement is very, very less. We see a lot of vitamin B12 deficiencies here and vitamin D3 deficiencies here. So these are generally what we have to address. And yes, it is important that when you have certain amount of hair loss, you visit the doctor. The doctor will definitely take you up through certain amount of investigation, basic investigation. Obviously, one is for the nutritional value. Second is for your to know if you have any kind of underlying metabolic disorders, like if you have dearranged hemoglobin, dearranged your HB1AC, that's your sugar levels, or if you have dearranged PCOS conditions like a polycystic ovarian syndrome or a thyroid issues, because these are again a metabolic disorders where your hair is going to behave very crappy and you're going to have a lot of hair fall. So these are things which you have to keep in mind. And after this series of investigations are done, we reach up to a particular point where we feel that, okay, now the patient has to be supplemented with these many things for a particular period of time with a particular dosage is important to give you the right results. So it cannot just happen blindly and blatantly. Whatever is trending right now on an Instagram or an influencer talking about you, this brand is good and that brand is good. I would always say that please go back, check with your doctors that is this the appropriate concoction for you? Do you even require it?
So we can say instead of being your own doctor, visit to the actual doctor and get it.
Yes, yes.
So, doctor, like after a hair loss, another very common problem between all of us is the dandruff. So, can dandruff cause hair fall?
Yes, absolutely. Dandruff can cause hair fall. See, because understand something, when your scalp is not clean, if you're piling up, so dandruff is again of various kinds. You know, dandruff is a very general term. But if you ask me, dandruff can be an oily or a dry dandruff. Again, an oily dandruff means that you probably have a condition known as seborrheic dermatitis, which also has a fungal element to it. Or if you have too much of dry scaling and too much of piling up of dry scales, it can also be an autoimmune disorder like psoriasis. So in these conditions, your hair shaft becomes weak. They are definitely weaker and they're easily breakable. So obviously, yes, you will have a lot of hair fall during these conditions. So keeping your scalp clean is one of the most important part of your hair routine to have a healthy hair growth and to have a good hair on your scalp. So scalp is something which is an integral part of your hair, which has to be kept cleansed, has to be kept healthy so that your hair follicles can sprout and the density can be better. So yes, these are dandruff is definitely one of the conditions where you can lose a lot of hair if not addressed properly.
So, even dandruff has its own type, and yeah, it is very necessary to get the treatment according to the type of your dandruff instead of applying those shampoos ki dandruff chala jaye.
Shampoos and lemons. People use a lot of lemon, nimbu. They
Yeah.
keep scrubbing their scalp with those acetic acid and these kind of agents which can actually aggravate the condition.
Okay. Yeah, yeah. Very interesting, doctor. So, doctor, like we have talked about lifestyle, and one more problem in our lifestyle is the stress, which is unavoidable. So, is there any impact of stress in our hair health?
Yes. So obviously, stress is an inevitable part of our all our lives, including me. Okay. So here, what I normally say, if I tell you, Mona, today that you should not stress and don't take stress and live your life happily, you would probably run away from me because it's not practically possible here. Okay. So let's face it together and understand that stress is something which is unavoidable. Sometimes it's home, office, wherever. But yes, if too much of stress is not being neutralized, okay, if the stress levels are not neutralized, then yes, it definitely affects your health here as well because you are going to indirectly cause a disturbance in your circadian rhythm. You are going to increase a lot of cortisol levels in your body, which will definitely cause a lot of inflammation to your root of the follicle and cause hair fall. Okay, it is also going to disturb your good hormones and which is again going to influence your hair and is going to fall. So what I would say that there's a buildup of oxygen free radicals also when there's a lot of stress. So what we have to do is we have to learn to handle this stress. As I keep saying, neutralize the stress. How do we do that? Again, simple things that we should keep in mind. Obviously, having good sunlight exposure, that is something which is very important in the morning. If you just look at the sun for 10 minutes, it basically activates your photons and it helps you to maintain the circadian rhythm. It also releases melatonin in your body, which at the right percentage is also help for healing. Secondly, is that exercise. Have a good healthy regime. Whatever you want to dance, you want to cycle, you want to do yoga, swimming, whatever form of exercise is okay for you, but please ensure that you are exercising at least 3 times a week. Third, again, is the sleeping habit, which you should be going on time to sleep, which will help you to, take care of your oxygen free radicals and the stress levels as well. Fourth is that having healthy food habits. As I keep saying, that cutting down a lot of sugar, a lot of dairy products, which will help you to maintain the homeostasis and will help you to deal with your stress better. Drinking lots of water, fluid intake, which is again a very important part for all of us, which will also help you to take care of your stress levels at some bit of because your body function is better, your hydration levels are better, and you feel less tired, dehydrated, and this shows up to your skin and hair both. So these are simple practices which I normally feel because stress is something which is going to be a part of our life always. And as I keep saying, that you have to take care of this stress by certain things, making certain small changes around your surroundings, around yourself, and include, and as I said, have your right multivitamins, take care of your calcium intake, take care of your vitamin D3 intake, keep checking your hemoglobin levels, see that your HB1AC, your sugar levels are in place. And these smaller things I think should be able to take care to a certain limit about your stress. Obviously, again, there is a disclaimer here that stress can be of various levels as well, Mona. So sometimes stress can be we can deal it in and day out with certain small practices. But sometimes, if it's severe, then you also need to take a professional help.
Okay. So managing stress is very important, not for only our body health, but also for the hair health. So it's very important to manage our stress. So doctor, like when we are talking about managing stress, एक सबसे easy नुस्खा जो हमारी मम्मियाँ हमें घर पे भी बोलती हैं कि oil massage कर लो. And they also mention that oil भर भर के लगा लो, ऑयल लगाने से बाल लंबे होंगे, घने होंगे, बहुत ज्यादा ग्रो करेंगे. So is it like, what do you recommend? Oiling hair is boon or a ban?
Okay, so oiling should be taken with a pinch of salt, if you ask me. Okay, so there are scientific reasons for it that it's a very difficult question, especially in Indian scenario, to answer. That is oiling a vein or a boon, because my patients get really upset when I tell them not to oil their hair. Okay, that is. I would tell you a little incident about my own life, about when I used to tell my mom that I am not supposed to oil my hair. It doesn't require. My mom used to say that you're foolish. You must be a doctor in your cabin, but your hair is going to get gray faster if you don't oil your hair. Okay. Yes, oil has its place, but you have to understand the application time and what kind of oil you're supposed to use. Now, oiling is good because you're using it and you're using the circulation. The malish karte when you're using your fingertips, and there are nerve endings which helps you to feel better. The circulation increases and you feel good. So that's how your oiling helps to calm your mind. But if the oiling goes overboard, if your scalp is not clean, oiling should be only done if at all required. If you fit into the category of a clean scalp, only for 30 minutes, not more than that, and you have to wash it away. Please stick to oil like simple coconut oil, that should do the job. Please do not end up going to castor oil, which is again a very common oil being used on the scalp for hair growth. So castor oil should be completely avoided. Keeping oil overnight should be completely avoided. Moving with oil all around, because that oily scalp might attract a lot of dirt and grime, and it will block your hair follicles, and it will give you more eruptions. It can sometimes give you infection, inflammation, sometimes bacterial infection on the scalp, and your hair will start falling more. So yes, hair, you have to condition it. So you have conditioners which are available. So even if you don't oil your hair, it's not that it is going to grow gray, or you're going to have a bad hair, or your hair is not going to grow. Because understand, hair growth is very, very genetic as well. You are born with kind of genes. If your hair, okay, so this is a lot of things to do with your, again, genes, lifestyle, eating habits. So yes, I would always say oil your hair if required on a clean scalp, but do not make it like a regular affair. Once in a while, it's okay to do it.
Okay, so once in a while is okay to use, and type of oil is also important, like you said.
Plain simple coconut oil is enough.
Okay, doctor. So, doctor, the favorite session of mine, please give us some important tips for healthy hair.
So the simple thing is that you can have 2 walnuts and 2 almonds daily. Every day you have it without fail, and this will definitely help you to see your mane very well. And as I keep saying, that eat well, which we all can do, because this doesn't require too much of efforts. So if you can eat well, that is something. Your diet should be good, which will have inclusive of a lot of proteins. So if you can do that, I think your mane will be very, very healthy and less prone to breakage and less prone to hair fall. And please do not think that nobody is in this era or in this world that who doesn't have a single hair fall. Be inclusive. We all lose hair, which is very, very normal.
Okay, so losing hair is normal, and if you are losing excess hair, we should visit to the doctor, and we should not become our own doctor.
Yes, that is something. And people do a lot of DIYs, Mona, here, which I want to also tell them that I would rather want to eat them rather than applying on my scalp. Like eggs are very common agents to be used on the scalp. So viewers, if you are doing that, rather put that egg in your mouth, that would benefit you better. So
Okay.
it's always It's always better to use all the kitchen products to eat, but not to apply.
Okay, okay. Very interesting, doctor. This discussion was very informative. I'm sure our viewers would be benefit by it. So, doctor, can we take some live audience question?
Sure.
So the first question from our audience is, doctor, is the excessive oil on hair can cause hair fall or increase in the number of hair falls?
So, in general, excessive oil can give you hair fall. It can give you easy breakages, like hair can easily break. It can give you an oily scalp and block your hair follicles and give you eruptions. Also, can aggravate your acne or give rise to acne as well. So, oiling should be done once in. If you ask me, if you really like it, and if you really like the soothing nature of that oil, you can probably use it once in a 15 days. That would be safe to use, but ensure that your scalp is clean.
Okay, okay, okay.
And wash it within 30 minutes. Do not keep it overnight.
And doctor, some people, even they don't apply oil, but their scalp is always oily. So can it cause hair fall?
No. So when you have, yes, if you have an oily scalp, for example, that means your inherent sebaceous gland, the oil glands are pretty active and they are secreting a lot of oil. In that case, you have to keep your hair scalp clean. So you might have to take to washing almost daily or the other second day. Probably with shampoos mild in nature, because you need to wash it regularly. So the shampoo should be sulfate free, paraben free, and which can gently cleanse your scalp without giving over dryness to your scalp. And that's where, yes, oily scalp has to be a little more careful compared to a normal scalp.
Okay. And the question is very interesting. Doctor, is there any particular food that can help to grow hair?
So particular food, as I keep saying, that you see, which you one is the protein. Your protein source should be really good, which will help you in your hair strands and it will really be strong. Second is like food which contains a lot of vitamin B12 and D3. Okay, so your leafy vegetables and B12 are your meat. If probably if you're a non-vegetarian, that's the best source to have. And zinc supplements sometimes can help you to give you good hair. And you say if you really just generally want for a healthy hair, you're okay with all your nutritional value, and what can help you is these are the foods which will help you to keep your mane really well.
No, then there is nothing like particular food like they eat an apple, grow hair. It's like
I
combination.
wish I wish we could have one formula which would fit everybody and everything, but no, it's not that. And as I keep saying, that if you really want to, I would not say the drug or the medicine, but something which really works for me is my almonds and my walnuts. These are something which, if you can include in your diet, irrespective of whatever you eat, apart from that, will definitely help you in your great hair.
Okay, very interesting. So even nuts are important for our good health.
Yeah.
Okay. Another question from our audience is, डॉक्टर मेरी बीवी को बार बार अपने बाल नोचने की आदत है और सबसे ज्यादा तब नोचती है जब वो स्ट्रेस में होती है। ये क्या प्रॉब्लम है? ये कोई साइकोलॉजिकल प्रॉब्लम है? तोड़ती क्यों है और उसकी वजह से उसका स्कल्प भी आगे से कम हो गया है? क्या करना चाहिए?
Okay, so what I understand from this query is that she is suffering from something known as trichotillomania, where a patient subconsciously, picks up the hair, okay, and breaks it by their own hand. They don't even know it that they're doing it, and they do it because they're with an undue stress. So in such conditions, I would advise that you visit the doctor. Second, she might require a few investigations to see what is also, relatable to her nutritional value, and we have to connect the dots, and she has to be treated parallelly for her stress as well as for the hair fall and the breakage. So the treatment would definitely involve a medical intervention where it could be simultaneously treated where her stress is also being taken care of. We have to find out the core reason of her behavior, because if you do not go to the core here, even if you supplement with the hair supplements here, she will keep still doing that habit of hers of picking up her hair. So even if we supplement her or we give medicines to treat the hair fall, but she will keep having new patches and she will keep breaking them more. So we also have to reach up to the core of the stress, that what is causing that behavior. So this is something what has to be done. So I would advise you, please visit the doctor.
Okay. Okay. So even stress can lead to the
Yes, there are certain psychological indications and types where patients actually pull their hair. And sometimes, as I said, that you get alopecia areata, which is also immunity induced, which is also stress related. You get circular empty patches on the scalp, sometimes on the beard, sometimes you lose it on the eyebrows and eyelashes, and sometimes if it's too severe, it can go through hair all over the body, you can lose it.
Very, very interesting. Okay. Stress management is important. So I'll quickly take the last question because we are running out of time. Doctor, how to take your appointment? And also, my daughter is 12 years old. I want to take appointment for her. She's having a lot of gray hair. Can we stop it or can we do any hair transplant on her? Hmm.
Okay, again, gray hair, premature graying is again one which is very genetic. Secondly, we have to look at her vitamin D3 deficiencies and her nutritional deficiencies because that's where your child starts getting the premature graying faster. And third is that if this child, if she's a daughter, if she's her menstrual cycle has started, is there any issue in those areas as well? Is this kid obese? And there are a lot of things which I have to go through the medical history to understand. Yes, you can always visit me. If you search me on Google, you will see where I'm practicing, and you can always visit us, and we can always help you with the treatments, and we'll be more than happy to see you here in the clinic.
So premature gray hair can be reversed or can be stopped?
Premature gray hair, as I said, that if it's strongly genetically derived, we probably can deal with it, but we can't stop it completely. Okay, we can delay the process, and we do have medications for these kind of graying as well now in the market with oral supplements and topical applications. But a complete stoppage is not possible at times. Okay, but if it is typically because of a nutritional deficiency, yes, it can be reversed.
And at such a young age, can transplant happen? Because he answered.
Transplant, yeah, the transplant is not the answer for this because understand today, even if I say yes to a transplant and we do a transplant, but again, the transplanted hair might turn gray.
Okay, okay, okay.
That's not the answer here. The answer is the core problem that we need to find out the reason for her graying.
Okay, okay. So the root cause is important. So
Yes.
you visit the doctor by using the Google system, Dr. Soma Sarkar, and she will help you to get the appointment.
Yes.
Thank you so much, Doctor. So, Doctor, would you like to give a take-home message or any other message to our viewers today?
Yeah. First of all, thank you, Ipka, for such an amazing initiative here that you are doing into a patient educational program. And secondly, it's that please ensure that you keep your eating habits, your daily routine in place. Simple habits can give you great and big changes in your life concerning your hair or skin and health, actually. So, skin health is something which is also relatable, as I said, that there are ways and means of keeping it upright. And so, my I would say goodbye by saying stay happy, stay beautiful.
Thank you, Doctor. Thank you so much for sharing all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found the session very helpful. And thank you so much, Doctor. It was a delight to have you. And thank you so much for your valuable time.
My pleasure, Mona. We'll see you soon.
See you soon. Thank you, ladies and gentlemen, for joining us today. We are signing off for today.